Hi everyone, this is Gunay Ajapayamla. I am a Johns Hopkins nurse. I have been working at Johns Hopkins Psychiatric Emergency Services for the last 5 years now. This is a short film to introduce you to what it means to work in an emergency department that also has emergency psychiatric services. In this short film, you will be introduced to a tech and also another nurse and also a nurse practitioner. They will each tell you what their roles are at Johns Hopkins and how they got there. I hope that you enjoy the film and let us know if you have any questions.
All right.
Aisha, will you introduce yourself to us?
Hi guys, my name is Aisha. I work as a clinical technician at Johns Hopkins Psychiatric Emergency.
Can you tell us how long you've been in this position?
18 long glorious years and in the same department.
So how did you choose to become a clinical technician? Was there somebody in your family that was doing it, or what got you started?
I started as a geriatric nursing assistant in 1996, and then it was advertisement in the paper. I know it's a little old, but in the paper for Mercy Medical Center, they were training CNAs and GNAs to be nursing support technicians. I took them up on their offer. They sent me to college. They sent me to the Community College of Baltimore County. It was a 3-month program. We did clinicals at Mercy and our theory at the school.
Oh wow. And how long or what made you switch to psychiatry?
Psychiatry chose me. I actually put in an interview for the hospital, and 3 departments had canceled all but psychiatry. And I remember when I was like, what am I going to do in psychiatry? And I was task orientated. So when I was like, how many patients do you have? What do we got to do all day? And I was like, okay, I'll take it. I'll figure it out. But it was more than just tasks, and that's the huge difference between being a medical tech and being a psychiatric tech.
So can you tell us a little bit of what that means? What is a psychiatric tech? What are some of the tasks you do, and then what are some of the stuff that you do in addition to that?
So we still have the same tests: blood draws, IVs, vital signs, and Foley's, all the things that we do as nursing techs. But as when you add the psychiatric component, I'm coming in, I'm looking to see if you're grimacing. Like, are you okay? Are you feeling okay? What's on your mind? If you're maybe withdrawing. I'm paying attention to that versus just paying attention to your blood pressure. And making sure your mental is good on top of your physical. Because when you're not taking care of yourself mentally, you're not taking care of yourself physically.
See. And how would you say, can you just give us a little bit as like an example of what your day is like in the psychiatric emergency department?
Okay, so every day is different in some cases. I have the same duties, but every patient is unique. So I'll come in, I'll get report from my nurses and even from my tech from the previous shift. We talk about more like vital things. What's important, like maybe Mrs. A is not wanting to be alone in a particular space and does better sitting in this room. Mr. B, well, he doesn't like the guys in the uniforms, but he does better with the females. So make sure you talk to Mr. B. If it's somebody their first time in psychiatry, let them know that it's not a bad thing to be here, that it's actually a good thing. We have a lot of constant changes, so patients come and go. They don't stay for a very long time. And that's the good thing about it. We get to spruce them up and send them out.
And so, and how would you say the psychiatric emergency services is different than like a psychiatric inpatient unit?
So the emergency, you are coming to us in crisis. Once you come to us and we check, make sure your medical is clear, we evaluate and see if you would be better suited something long term versus short term. So we stabilize. We say like, okay, you know what? Miss So-and-so is just having an anxious moment. Let's get her on some medication, see how she feels. She feels better. She really won't benefit from being in here, so we'll send her outpatient to see somebody. Or, yeah, this medicine isn't working. She's not looking too good. I think it'd be safe to say that she could benefit for a couple days or maybe a little bit longer on the inpatient unit to get her balanced out. So that's the difference. Inpatient is the long haul. They're doing checking to see if the medications are working, seeing how you're doing every day, versus we're just in that moment. And I think that's the big difference. I did inpatient as well.
And what are like some of the therapeutic help that you give to patients? Can you give us just like examples of some of the things that you do for patients that would be just on the behavioral health realm?
Sometimes it's just they just acknowledged, reassuring them that it's not just them, that they're not alone in this fight. It's not anything negative. It's actually a good thing that they're here, because a lot of people see psychiatry as something bad. And I reassure them and let them know this is actually a really good thing that you're here. Taking care of your mind is taking care of your body. Comfort, making them feel safe. Some people don't feel safe out in the world. Things that went on. I could just go on and on and on, because everybody is so unique in these situations. And the same person may come different times but have different needs.
Got it. And what range of patients do you see?
From 18 to 100. From the janitors to the doctors, school teachers, bus drivers, housewives, house dads, uncles, aunties, everybody comes through psychiatry.
And what type of psychiatric illnesses do you guys see most?
A lot in this particular area. We have a lot of depression. Actually, it's really hard on people out here, and we a lot of times aren't taught how to deal with stress. It's a lot of stress and depression. People not feeling like they're enough, they're not doing enough. They can't get straight. A lot of trauma. This is an inner city hospital, and a lot of our patients have been victims of traumas, all kinds of trauma and violence. So we see a lot of that.
Got it. And thank you for taking the time to do this. Just lastly, if there are students who are, interested in what you're doing, what would your advice to them would be? What type of paths can they take to become a clinical technician?
To make sure this is what they want to do. In nursing, you have to have empathy and love. You really have to have love for your fellow man, because it's so diverse. And patience and understanding. It is a short course. It's a certificate course. If you, some places start you off with your CNA. Some don't, but you can take your CNA at the community colleges. Even some places have them for free. The community colleges are offering free programs. They are 3 to 6 months. They do clinical and theory. You'll train at some of the hospitals, or even like clinics and nursing homes, and you can use this particular position in so many areas. It's not just psychiatry. You could do heart, you could do emergency, you could do mother and baby. It's no limits to where you can apply it to.
Thank you, Aisha. We love you, and thank you for all you do.
I love you.
Hello, Emmanuel. Can you introduce yourself to us?
My name is Emmanuel General. I've been a nurse now over 6 years. I've been in psych, mostly in psych, for 6 years now.
Okay. How did you, can you first tell us how you went into nursing? Why did you go into nursing field?
So initially I had studied engineering, came into the United States to further my education, but that didn't work. So I decided to take up nursing, and it's been rewarding ever since I transitioned from engineering into nursing.
How long did it take you to do that?
So typically, it all depends on what path you want to take. If you want to take the traditional bachelor's route, it takes you about 4 years. But in my own case, I had to take some classes. So it took me about, almost 4.5 years.
4.5 years?
Yes.
Okay, perfect. And then did you start in psychiatry when you started nursing your career?
Yeah, initially I did psych with home health, then did a little bit of community health, but later settled mostly in psych.
And what attracts you to psych? What do you like about psychiatric nursing?
Psych is more of helping those that are really stigmatized, those that really need help. I feel like psych is the hallmark of nursing. It's, you know, brings different areas of nursing like med surg, like telemetry, long-term care, because everyone for some reason has some mental health problems
Right.
that needs to be addressed. So it's, you know, it's like the
Combination.
combination of everything in one.
Yeah. And then right now you're working in the Johns Hopkins Hospital's emergency psychiatric unit.
Yes.
Is that correct?
Yes, yes.
So can you tell us like a little bit of what the difference is between like an inpatient psychiatric unit versus the emergency psychiatric services or unit?
So the difference is the inpatient unit is more of a stabilization unit, like where we. So let me go back. So the way it is the emergency department acts like a crisis admissions unit where they come in, we kind of like get them stabilized a little bit, get their medications, then we place them in inpatient units. So when they move to the inpatient unit, it's more of like a long-term stabilization unit where we're able to manage the patients more on medications, group therapy, and help them cope with certain tools like resources, group therapies, DBT, IPT programs. And when they become more stabilized, they transition back home or to group home settings or assisted living settings.
Got it. So I'm hearing you say that basically you guys get some of the sickest patients in the emergency, the emergency psychiatric unit.
Yes.
When you see them first, and then once they are thought to need inpatient admission, then they're sent to a floor. Is that correct?
Yes. So the emergency services sees a lot of patients that need a lot of help. It could be homeless patients. It could be patients just needing medication adjustment. It's so much. It's so broad. But we see most of our patients or most of the population coming into the emergency services do not have necessarily have the resources to sustain them outside. So we help them. We do see a lot of sick patients coming in to us, and when we try our best to stabilize them, then we give them resources or transfer them to different facilities or to other inpatient units.
Got it. And then another question for you is, if there was, if some of these students who are watching the video are interested in nursing, what would your advice to them would be to go to, for this career? What do you think it takes to be a nurse?
I think, just like any profession, any field, it takes dedication, hard work, commitment. You have to take your time, study hard, and it's a very rewarding field. Nursing, it's very rewarding. You get to help a lot of people. It's rewarding to you, rewarding to those you're helping, and you're making a significant impact in one's life.
And what do you do with, like, on your off days to just kind of, I'm sure there's a little bit of burnout after, sounds like you work at an environment that can be a little bit hectic. What do you do to kind of like take that stress off?
So for me, everyone is a little bit different. For me, I typically, just go around, travel to a place, go to different areas. Sometimes I just, it might be just watching movies or something that helps, calm and take your mind off from, the stress and the burnout from work. So it's very important to always take the time to do other things, something to, keep you calm.
Thank you so much for taking the time to do this.
Thank you.
We appreciate you.